Welcome to a brief webinar on the challenges of fear-based approaches. My name is Otto, and I work for the Center for Health and Safety Culture of the Western Transportation Institute of Montana State University. We conduct research on improving health and safety by growing positive community norms and cultivating cultural transformation. We work on a variety of issues, including traffic safety. Fear appeals are persuasive messages that scare an audience into adopting a recommended response. And fear appeals are effective with many people. However, we need to ask the question, are there any unintended consequences from using fear appeals in our work? The research has shown that there are several negative consequences of fear-based approaches. First, fear may create misperceptions. Let's take a look at this ad. The language is very clear. Chugging can kill, and this is very true. People that overconsume alcohol in a short period of time can die from alcohol poisoning, and this impacts a number of people every year. However, the story that's also told in the image is that it's the really buff, attractive guy who's engaging in this behavior. He's become the center of attention, and it may create the sense that this behavior is very common, when in fact it's relatively rare. By creating the sense that this behavior is common may in fact lead more people to engage in this behavior. A second consequence of fear-based approaches is that it may fractionalize community. Sometimes fear-based approaches can create a stigma associated with those who engage in the behavior. This stigma can result in a loss of trust between the general population and those leading prevention efforts. The stigma can also reduce the likelihood that people will be comfortable talking about the behavior, and also reduce the likelihood that they may engage in protective behaviors. And finally, fear-based strategies can be very hard to sustain. If we go back 35 years and we look at a horror movie from 1975, the violence almost seems silly by today's standards. And then if we look at a horror movie of today, the graphic detail has come so much further in those 35 years. The challenge becomes that we have to raise the bar on how graphic something is in order for it to create fear, that at some point we may cross the line. And in fact, research has shown that individuals will reject messages that become too graphic or gross and will literally change the channel to avoid seeing it. So our challenge becomes how to create a sense of concern, because we absolutely need to create concern around the issues that we're addressing. But we want to do this without fostering misperceptions, without fractionalizing our communities by creating stigma, or creating a sense of fear that is so severe that people are rejecting the message outright. The question then becomes, what is the difference between concern and fear? In our work, we recognize the need for a new frame for our prevention work that combines concern and hope. At the center, this is the work that we do to seek to better understand how we can improve health and safety by growing positive community norms and cultivating cultural transformation, and address the challenges of raising concern and hope in our communication efforts. Thank you for listening to this brief webinar on the challenges of fear-based approaches.